My name's Cameron. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Taylor Hicks, December 3rd, 1999.
See your bracelet. Okay. I'm going to be performing a respiratory assessment on you today. I'm going to ask you if you have any issues breathing recently.
No, I haven't.
No? Okay, cool. I'm going to first just start by inspecting. Your skin color looks good. No cyanosis or pallor. I don't see any edema. Don't see any difficulty breathing. No use of accessory muscles or pursed lip or anything like that. Could you put your hands out for me like this? Test your capillary refill. Looks good. Under 3 seconds. And then if you could just put your thumbs together like that. And no clubbing. That's awesome. Do you have a cough?
No, I don't.
Okay. And then if I could just get you to stand up really quickly. And then her AP diameter is 1 to 2, which is normal. And if you could just bend over. I don't see any lordosis, kyphosis, or scoliosis, things like that. You can sit back up. And I don't see any abnormalities in her chest. No pectus, excavatum, or carinatum. And you can sit back down. Now I'm going to just assess her respiratory rate, which I've already done, and it's 14. The rhythm is normal, the depth is normal, and then I would take her pulse ox if I had the device. 99. Okay. Next I'm going to palpate, and normally I would do this with no clothing covering it while I do that. But I'll palpate above the clavicle. Do you have any tenderness when I do this? Below the clavicle and the sternum, any tenderness? No bulges or masses felt there. And if I could get you to sit up and turn a little bit that way. Okay. I'm going to palpate above the scapulae and then down both sides of the spine. Any tenderness? Okay. No bulges or masses. And then if I thought there was any consolidation or hyperinflation of the lungs, I would percuss. And to percuss, I would go above the apices, and do that. And then normally you would hear a resonant sound, but over clothing, you're not going to hear that. And just palpate all the spots you would auscultate, pretty much. And then I would do that to the front as well, if you could turn back towards me. And then I'll palpate above the clavicle and below the clavicle. Sounds good. Now that I've done my percussion, I'm going to auscultate. I'll start posteriorly. Once again, you'd want to do this with no clothing covering the area. I want to warm up the diaphragm. You want to start here and listen for one full breath. I'll ask you to turn to the front. No abnormal sounds were heard during that auscultation. Didn't hear any adventitious sounds like stridor or ronchi or anything like that. Sounded good. And then I did forget to do the thoracic expansion, so I'll ask you to turn around really fast. The 10th rib, and if you could just take a breath in. And then it's symmetric. You look good. Respiratory assessment's good.
Thank you.